And thank you for joining us for this edition of the videos about the COVID-19 health crisis. Today we have with us Beth Wright of Wright Insurance Company Incorporated. And Beth, I'm going to ask you just to tell folks a little bit about yourself and then tell us what you've been doing to help out with the COVID emergency in Eagle County.
Great. Thank you, Kathy, for having me. I have been an insurance broker in the Valley, selling primarily health insurance for over 30 years. Helped a lot of people, know a lot of you people that have individual coverage that were lucky enough to get onto group coverage. Anyway, I would love to just speak to everyone today. I'm trying to hit all the different population areas as far as coverage goes. Right now for Eagle County, I am volunteering for the wonderful COVID-19 Emergency Assistance Fund. So I've been able to make contact with a lot of people. And of course, the thing that keeps coming up repetitively would be medical coverage. Do you have medical coverage? And that's kind of what I wanted to address with everyone today. What options are out there for you?
That's great. We really, really appreciate this. And we will leave this up on One Valley Voice as sort of a tutorial on health insurance. So Beth, I'm just going to turn it over to you and thank you for all your work.
All righty, you bet. So let's start with the first population of people. I don't have an income and I have no coverage right now. So people that have no income right now or a very low income may qualify for Medicaid. Our Medicaid in Colorado is called Health First Colorado. It's a free program, might be $25 a month for some people, very affordable program. Kathy's going to post the link to Colorado PEAK application. PEAK stands for Premium Eligibility Application Kit, and it will take you right through the application process. You should get instant determination. If you qualify for Medicaid, another portion of that would be the CHP program, which is for children. That also is a wonderful program that they have available for you. So again, a very low income level or no income at all would get a lot of people eligible for the Medicaid and the CHP. The second population of people would be the people that don't qualify for Medicaid, but they qualify for tax credits. This is the Affordable Care Act, which a lot of people refer to as Obamacare. That website is connectforhealthco.com. There are phishing sites, so we'll make sure we get it correct on the video for people so they don't get into a phishing site where someone's calling them 24 hours a day trying to offer them health insurance. Nobody should be calling you. So if you're on the right site, you will not be on a call list. Connect for Health Colorado has opened up a special enrollment. So if any of you understand the Obamacare plans, we have an open enrollment in November that ends December 31st for coverage January 1. That's the only time people that don't have health insurance, that don't have a qualifying event, I lost coverage, I got married, I moved to Colorado, those are all special events. But otherwise, people had to get on and have insurance January 1. If you missed open enrollment and you have no coverage right now, Connect for Health will get you covered. Right now, open enrollment, this special COVID-19 open enrollment will be extended through April 30th for a May 1 effective date. Single people making under $49,960 would qualify for tax credits. Tax credits are a reduced premium payment. So in other words, if your monthly payment would be $450, you may qualify for a $100 a month payment, $75 a month payment. In addition to that, based on your income, you may also qualify for what's called cost sharing reductions. So instead of an $8,150 deductible, your deductible may be reduced to $1,900. And again, that's all based on calculations when you go in there and report your income. So individuals making under $49,960, which is going to be a lot of us now, families of four, for instance, making under $103,000 would qualify for tax credits based on 2020 projected income. If people go into Connect for Health Colorado and apply for this COVID open enrollment plan, the only carrier that's available, so you have to shop them through Connect for Health to buy the health insurance to get those tax credits. The only carrier we have available in Eagle County is Anthem, which is our Blue Cross Blue Shield in Colorado. I just want to let people know there are two different networks with Anthem. There is the Mountain Enhanced Network. The Mountain Enhanced Network covers doctors, facilities, hospitals in Eagle and Summit County only. So if you go to Glenwood Docs, if you want to use Valley View, if you have Denver Docs, you want to go to the Pathway HMO network, PATHWAY. So those are your two network options, but otherwise the plans are all pretty good. And that's the only place you can shop to get the tax credits and cost sharing reduction. Colorado is one of the very few states that have actually opened up this special enrollment, which is really awesome. Over 5,500 people have applied in the last 2 weeks already. So we're really getting people coverage that they need, because the COVID may send people to the hospital, and we want to make sure we have as many people insured. So that's just one less thing that we all have to worry about. We have enough to worry about right now, right? The other situation would be loss of employer coverage. So now a lot of people have been furloughed, laid off, reduced hours. People that have these situations happening need to reach out to their employers and ask the questions. Hey, are you keeping my insurance? Are you paying for my insurance? What am I going to be responsible for? Because the last thing we need is for a bunch of people to come back to work in 3 months and your first 6 paychecks are completely zero balance based on the projection of, oh, by the way, the minute we furloughed you, you're going to owe 100% of that premium. So we really need people to talk to their employers and say, what's the plan? Are you going to keep us on the plan? Who's going to pay for the plan? What's our contribution towards the plan? If they're not going to pay for the plan, they should be reaching out and doing some COBRA or state continuation. So COBRA is it's a federal law that would allow you to continue on your plan for up to 18 months. That's only for larger employers, and there's a lot of small employers in this valley. For the small employer, if number one, you've had to be on the plan for 6 months to actually qualify to continue on their plan. And it is 18 months as well. So you need to talk to the smaller employer. Number one, are you keeping the plan going? Because if there's not a plan in existence anymore, there's nothing to continue or COBRA off of. So there has to be at least one person remaining on any of those plans. So I beg you, talk to your employers. What's happening with the insurance? If they are terminating your insurance, that would be that qualifying event to come to Connect for Health to get those tax credits, to apply for Medicaid. So that's one thing. So basically keep the line of communication open with the employer, and they may say, we're going to cover you through the month of April. But towards the end of April, make sure you reach out to the employer and say, what about May? What about June? If you are an employer, again, the reverse, stay in touch with your furloughed employees. If you've reduced their hours, the insurance carriers, the group insurance carriers are going to be very generous and liberal about reduced hours. If you have a 35-hour, 40-hour a week minimum for these people to qualify to stay on your plan, they're going to be very relaxed about it. So if you're down to 10 hours a week, it's okay. They can stay on the plan. But again, reach out to your employees and let them know, we're going to keep you on the plan. We're paying for your insurance. If we're not going to pay for your insurance, we're going to send you information about how to COBRA or continue off the plan. Now, remember, when you COBRA or continue off a plan, you are paying 100% of the premium. And for some of these group plans, that can be upwards of $2,500 a month and more. You do not need any more surprises right now in your lives. So that's why it's really important to keep that going between employee and employer, finding out who's paying for it, how much it is, because it would be much easier for you right now, if that insurance is going to stop, to go to the marketplace and get a reduced premium plan, or to get yourself on Medicaid to make sure you have that insurance. There's a lot of insurance carriers offering free telemedicine, and of course, with all the clinics closed now, it's very important that you have access to talking to a doctor about your concerns about COVID. So I know Anthem is doing that for the individual and the group market, and a lot of people here in the Valley are on Anthem plans. I think I will close with just recapping. Medicaid is an option. Connect for Health Colorado is an option. Staying on your employer group, whether they're paying for it or you're paying for it, is an option. There are private insurance carriers out there. Make sure if you're shopping on the private insurance market that it is actually a real insurance company, because there's a lot of stuff out there that's not insurance. And you can ask them or you can look up on the Department of Regulatory Agencies and make sure that the insurance company you are going with is actually regulated by the Colorado Insurance Commissioner, because then they have to follow some rules and checks and balances on that. I would just close on saying thank you, Eagle County, for doing such a great job. I think we're in such great hands here. And I just pray that everyone stays healthy.
Beth, thank you very much. This was really great information. Check the first comment box below this video and you'll see Beth's contact information as well as links to all of the programs that she talked about. Really helpful. Thank you, Beth, and thanks everyone for joining us today.
Thanks.
Thanks.